you're watching DtheNP YouTube, none of the information on this channel is sufficient nor intended to diagnose your personal medical issue, but there's a lot to learn, so let's go. Hey guys, it's DtheNP, and I just wanted to come to you really quick and straighten out some misinformation that has been swirling all over social media and all over the internet. Now, there are a couple of drugs that you will hear being talked about all the time with regards to COVID-19. One is called hydroxychloroquine or Plaquenil. The other is called azithromycin, also known as a Z-Pak. So let's talk about these drugs. Hydroxychloroquine is a drug that's used to prevent and to treat malaria. It's also used with people who have lupus and people who have rheumatoid arthritis, both of which can be very debilitating diseases if not properly managed. Azithromycin is an antibiotic. You've probably got a Z-Pak at some point for a sinus infection or some other symptoms that you are having. These drugs are necessary for conditions that we know that they're approved to treat. And yes, sometimes clinicians prescribe things for off-label use. But let's think about something. If hospitals are being overwhelmed with COVID patients, who are some of which part of clinical trials for these drugs, and the people who have been using these treatments for their rheumatoid arthritis, for their lupus, for their malaria, are still needing these drugs, then we need to be mindful of hoarding, of trying to get medication just in case, of prescribing medications for friends and family members just in case. Let's not let our anxiety get the best of us. There are randomized controlled trials in place right now, and you can learn more about those at clinicaltrials.gov. I'll put the link in the show notes. But let's not get crazy. Do the things that we know to do to slow and prevent the transmission of this novel coronavirus. Wash your hands, wipe your surfaces, and physically distance from people at least 6 feet and as much as possible. We're in this together and we will get through this. Thanks for listening. Just wanted to Thank you for watching. If you'd like to further support this work, head over to Patreon, where patrons enjoy premium access to additional Divinity health and wellness content.